This is all I've ever known. Is that even
Possible for me?
I don't want to miss anything.
I don't need that.
I don't want to acknowledge my pain.
Fine.
I don't want to get poked with needles.
I don't want that.
There's nothing wrong.
I'm fine.
I'm fine.
I'm fine.
I'm fine.
I'm fine.
I'm fine.
I'm
fine.
fine.
If it ain't broke, don't fix it. To be honest, I've never really liked that saying. Just because something isn't broken doesn't mean it couldn't be better. Then again, if a person doesn't have any concept of what better is or what better could look like, is it reasonable to expect any kind of a change? Today I'm joined by my friend, blood brother, and clinical social worker, Mosi Williams, to share some insights into how the I'm fine mindset has impacted him as both a person with hemophilia and a clinician treating patients with hemophilia. And we put a particular spotlight on the introduction of longer-lasting factor replacement products for a portion of this conversation. Mosi, always great to see you. Thanks for being here. And let's just dive right in. Have you ever experienced either fear or anxiety related to switching from one treatment to a new treatment for hemophilia? And if so, where do you think that fear or anxiety came from?
Yes, I have. I think it came from when I think about the past, and the bad blood epidemic that our community went through. And I think sometimes being anxious, it's like you kind of generalize the experience from the past. And even though, it's not the same in the sense that there isn't the risk there, there's still that fear, like what can happen, and then also in changing treatment, like what if it's not what I think it is, and then if the previous medication, like if I want to go back to that one doesn't work anymore, or for me, I have an inhibitor, and so there were, at a point in my life, there were certain products that did not work, and so then you think, if I try this new thing, will the inhibitor come back? Or will the previous not work? And so those are some of the things that, I thought about.
Mosi, as both a patient and a clinician, what do you recall from the transition from standard half-life products to extended half-life products? Was that a smooth and easy transition, or did it come with nuances for you or your patients?
I guess as a patient first, once I made the decision, and I had the information after talking to providers, and I was ready, and then I was able to, it was a smooth transition at that point for me. I felt that I would have more coverage, and I did. That was one of the reasons for going into it. For patients, we think about shared decision-making, and talking with them and talking with a medical provider too. Some will look at like the cost-benefit analysis of like, what am I gaining in changing medications? Some of the comments were, what are the life changes that could come from this, the pros and cons? Will I have more coverage? Will I be able to be more active? And so those were kind of the things that we kind of talked through with patients to see, what are the things that you're looking for from this, so there weren't unrealistic expectations.
Mosi, as you think about the future of treatment and management for hemophilia, for both yourself personally as well as for your patients, how do you recommend people challenge the I'm fine mindset?
It's tough because I think we tend to be like creatures of habit. And if something works, we're just going with it. Don't rock the boat, right? And particularly with the history we had, something is working and it's safe, and let's just, stick with that. And that's fine. But, as a mental health provider, sometimes, from a positive psychology perspective, is, this is working, but do you want more? What if there was better out there? I think about the book, Who Moved My Cheese, in terms of like thinking about change in life and sticking with this, and not that these things that we currently have, the treatments aren't going to work at a certain point, but, what if there is something else there that can also work? What I'll try to do is, in my conversations, saying like, what do you like about the current medication? What are the things that you like? What are the things you don't like? And then say, okay, well, what if there was a product that, these things were an issue for? I used to have trouble with veins and getting in the vein, even after so many years and basically being, proficient at it. But sometimes, veins are older and they're, you don't get the blood return. And so, if there are products that you don't have to treat as much or don't have to use veins, considering those, because it can be something that is helpful. And also talking to friends in the community, people that have tried other medications. I know patients that would say they wouldn't necessarily try something new until they've talked to somebody else, just to get their anecdotal experience, to look at the benefits and the challenges of the new treatment. So when somebody is thinking about, kind of sticking with what they're doing, just reiterating that we're not trying to, change your mind. You have the patient choice, but the challenge that you have or the things that you enjoy, what if there are other treatments that do those things better? And, what would that be like to think about something?
Hemophilia severity is determined by factor activity levels, a measurement of how much factor you have in your blood at time of diagnosis. The more factor you have in your body over time, the better your bleed protection is, which is why many people with hemophilia choose to treat prophylactically. Your doctor can perform measurements to evaluate the factor activity levels in your blood. Learn more about the importance of factor activity levels by talking to your doctor and visiting levelsmatter.com. Sanofi aims to raise the bar for patients living with hemophilia. Reimagine what's possible by visiting rareblood.disorders.com to hear more about Sanofi's dedication to the bleeding disorders community. Thank you, Mosi, for your personal and professional contributions to this conversation, and for discussing how treatment transition and the I'm fine mindset interact. I do want to underscore a point that Mosi made, that just because a new treatment or regimen might be available doesn't mean it's necessarily right for you. Challenging the I'm fine mindset is not an argument for rapidly and unquestionably adopting the latest and greatest that science has to offer. Challenging the I'm fine mindset is engaging in open-minded, shared decision-making discussions with experts and loved ones who can help you better understand what the options truly are and identify which of those options is best for you. Thank you, Sanofi, for supporting the I'm Fine segment here on Bloodstream, and we'll be back next time with another installment of I'm Fine.